Hello, we are live from the 77th World Health Assembly, and today we will be conversing with WHO's chief scientist, Dr. Jeremy Farrar. We'll talk all about science, new frontiers in public health. Jeremy, welcome to the Social Media Live. It's the last day of the assembly, and thank you so much for making time for our public audiences. My first question to you is, how do we build robust health systems to counter crises? Any anecdotes that you can share from your vast experience?
Well, it's a great pleasure to be here. It's been a long week, but a very momentous week, I think, in global health. So maybe we'll come back to that later. Well, first thing to say is I think there are already great health systems around the world. In almost every part of the world over the last 10, 20 years, life expectancy's got better. The number of babies surviving their first year of life and beyond has got higher. People are living healthier for longer. So we should just pause and celebrate that actually health systems are largely in a fantastic position. The question is, we live in a world of many complex challenges and crises. How do we make sure they're resilient for those? And I think wherever you go in the world, a health system is at the heart of every community. Every community has a nurse, a doctor, whatever it is, dentist, as part of their community. And I think making sure health systems are embedded in their communities is crucial. They build trust. And then finally, they're there for people every day. They're not there in a crisis. They're there every day. And then if and when there's a crisis, people know they're there for them. It's when you try and build health systems in the midst of a crisis, I think you struggle.
You spoke about crises. Right now, we just finished the strategic roundtable on the climate crisis and why the climate crisis is also a health crisis, but the connection between the two is not really intuitive. Could you explain our audiences why we should think of it in that way?
I think there's no doubt that the climate crisis is the biggest, in my view, is the biggest threat we face in the 21st century. And I think the health community, you and me and everybody else here, actually has been too slow to embrace the issues that climate is going to bring to us, because the climate crisis is a health crisis. There is some optimism in the way that's happening. COP last year was the first time there'd been a health day. That's a signal that actually people are now realizing climate is a health crisis, and it's not a health crisis in decades to come, it's now. I saw this I worked for almost 18 years in Vietnam. When I first went to Vietnam in 1995, there was no dengue in the north of the country. Now dengue is endemic in Hanoi in northern Vietnam. That's the same in many, many countries around the world. Huge dengue outbreaks in Brazil at the moment, I'm afraid, with the flooding. Waterborne diseases, heat, extreme heat. And of course, climate change also drives biodiversity change, and therefore it also drives the risk of pandemics and epidemics. So we have to embrace the fact that this isn't a crisis that's going to be in 2050 or 2100. It's a health crisis today.
And what about greening the healthcare, system? Like, how about reducing the carbon footprint of our own healthcare systems? What do we need to do there to walk the talk?
Well, I think firstly, healthcare professionals of any profession are still, thankfully, some of the most trusted in our societies, and I think the healthcare professionals' voice in the climate debate is critical. But we also have to acknowledge that the health sector, whether it's in the public health sector, in the private health sector, in the pharmaceutical industry, logistics, everything that makes health sectors work, is also a contributor to the climate crisis by the plastics it produces, by the greenhouse gases. So if we're going to be trusted and taken seriously on this, we have to put our own house in order. Yes. And on the scientific and health side, that also means not flying as much to meetings, conferences that can be hybrid, that don't have to have thousands of people flying around the world. So I think we both need to use our voice, but also we have to put our house in order. Greening of health clinics around the world, turning what are currently contributing to the crisis into something that is helping to prevent, mitigate, and adapt to it.
Now, you spoke about trust, which is an interesting conversation to have. More than ever, science is in the public eye, and the trust in science and medical technologies is at crossroads. How can we rebuild trust in science, scientists, and technology?
Yeah, and I think we're in a age at the moment. You're absolutely right. We are. I don't like using words of fight and battle and the rest of it. We are though. We're in a golden scientific age.
Yeah.
The progress is remarkable. I mean, we all saw that through COVID with the COVID vaccines. We've seen it in the development of treatments for cancer. Many areas, digital, data, AI. But these are also, in a way, AI and data, they can be frightening. And you can feel excluded from them. And so trust, I think, in science, in health, in healthcare professionals, in scientists, is absolutely critical. And we are, at the moment, I think, in the world, in every country, in a debate around what sort of world do we want. There's a debate about big issues. I think we've been through a relatively stable time over the last 50, 60 years in some ways. And now we're seeing technology and science moving forward very fast. Mm-hmm. There's a fear of leaving people behind. There's a fear of what it will mean for our societies. Yeah. And there's a question about that. I think we have to embrace that. It's healthy because we should debate these big issues. And I think we must do that by not realize we must come out of ivory towers. Scientists must get in public engagement, involvement, and we must rebuild trust. But it is a debate of the sort of societies we want, and we must engage in that.
You spoke about, scientists should come out of the ivory tower, which is, now what role does science play in, paving equity? Is that a tall order? Is there scope for science to do that?
No, I think if equity is not at the heart of science, then what is science for? Science is part of our culture. Mm-hmm. It's part of our way of life. It is for everybody. Yeah. You talk to any scientist, I think, anywhere in the world, and they'll tell you, I'm doing this because it's interesting, it's intellectually challenging, but I want to make a difference. I think at this golden age of science, as I describe it, we have got a choice. We can either choose to use that science to reduce inequity proactively, or I fear that it will increase inequity. Science can be driven by certain countries, it can be driven by companies, and we need to make the case that science can be for the benefit of everybody. If we don't, then I think inequity will increase, and we will all regret that.
Yeah, that's completely correct. And I just wanted to kind of also come to some granular topics such as tuberculosis, which is the world's top infectious killer. Now, talking about advances in science and how scientists want to do good and come up with solutions, what is really WHO doing to pave the way for a new tuberculosis vaccine? Is it in the offing, or what's going on that?
I've worked on tuberculosis most of my professional life, and I have never had the optimism of today. Mm-hmm. I think this decade, so in the 2020s, I think we will have, for the first time in 100 years, a safe and effective tuberculosis vaccine. In fact, probably more than one. I would never have said that 10 years ago. Not never have said that. I would not have predicted that 10 years ago. And yet the progress in science has been staggering. What we must do is make sure that TB vaccine, and when it comes, is available to everybody. And we can do that if we anticipate now what's coming. And we can say we don't just want the vaccine, but we want vaccination, and we want those vaccines to be used by everybody that needs them, which is the world. But TB is not just about vaccines. In the next few years, there will also be huge advances in treatment, in prevention, and in diagnostics, and in understanding the social determinants of TB. So I think by 2030, so 5 years from now, say, TB will be in a very, very different place to what it is today. And that's amazing.
That's yeah, definitely very good news for public health if that advances is made in tuberculosis. Now, you spoke a little bit about AI and the changing forms of technology, and we also had a strategic roundtable on AI and public health. So when it comes to digital health, how is WHO working in this space? This is not very clear to our audiences.
Yeah.
Could you?
So this is, I'm privileged because within the science team at WHO, we host the digital health team, and I just pay tribute to that whole team for what they've done. What they're focusing on is making sure that digital is not just for one community. Digital is not just for some parts of the world, but it's for everybody. And actually the digital transformation can also allow everybody to leapfrog where they are today to a more equitable place of the future, because nobody needs to invest in those things that now are no longer needed, and you could go straight. I think if we're going to try and achieve universal health coverage, if we're going to reduce inequity in the world, access to healthcare, then digital is going to be the way we do that, because it's possible that can reach the last mile, and it's possible it can reach the middle of big cities around the world. So it is the what I call the train tracks of the 21st century. If we can get the digital into every healthcare system in the world, trusted by individuals, patients and communities, then I think again, like TB, we can actually transform healthcare. And that's within our grasp. So why don't we grasp it?
Yeah, yeah. But there's also like a lot of fear going on around data privacy and confidentiality, and trust plays such a critical role in everything that we do. Now, how do we get people to understand that it's in a flux, but it's also there for the good, that technology is there for the good, and it could transform our healthcare systems or sector? I
think it all comes back to your first question, which is really the key question, is how can we ensure there is genuine trust? And I think you can achieve trust through transparency, but also you can achieve trust by having it useful to me and to you and to your families and my families. And people can not just see this as something abstract, but this is actually, they own it, it's theirs, they trust it, and they use it. And it's there when they need it, and I need it, and you need it. So rather than seeing this as some abstract, slightly frightening concept, it's about use, I think. And once you start using something, and I'm a late adopter of digital and technology, then I think you start trusting it.
That's very well said. Practice and, get acquainted with the technology, and then the trust, comes along. But will it be ambitious to think that with the current realities, digital health can make universal health coverage real, or is that again extremely ambitious?
I don't think it's ambitious enough. I mean, that is what will happen. I think it would be, the truth is, I think universal health coverage in the absence of the digital would be very difficult to achieve. Because there are communities, in rural communities, vulnerable communities, people who are marginalized, people who are outside society, people who don't want to be part of society in the way we construct healthcare. So I think digital is a way that you can ensure healthcare reaches the last mile, that if you're in a rural community in Vietnam, in the highlands of Vietnam, or in Peru in the highlands, or a country I've worked very long in Nepal, in the mountainous areas, you can still access healthcare. You can have somebody give you advice, maybe remotely, from Kathmandu to your village in the mountains of Nepal. So I think without the digital technological advances, equitably distributed, available to everybody, I think it would be much harder to deliver universal health coverage as a reality.
There's also a lot of criticism we sometimes get when we are leading various scientific innovations in terms of the information disorder out there. There's a lot of mis and disinformation when things are not concrete and science is always evolving. There's also a room for a lot of let's say, rumor mongering, fear mongering. How do scientists really navigate those kind of murky territories, or generally people?
I'm not sure I can navigate it better than anybody else. I have to say I'm a little bit more optimistic than your question says. I think actually there is more inherent trust than we think there is. I think all of us, you, me, everybody, I think is much better at discriminating between misinformation, bad information, and good information. Much better than we sometimes think people are. And again, as an example of that, take you back to 2020 and the COVID pandemic, and if you'd said to me that 6 or 7 billion people around the world would voluntarily have a vaccine, and come back for a second dose of a vaccine and a third dose, with a technology mRNA which had not been widely be used before, I would have been amazed. So I think that there is challenge and misinformation. Challenge is not a negative thing, though, because challenge makes you think, am I right?
Yeah.
But I actually believe there is more optimism and actually more trust than sometimes we think from some of the commentary.
That's a very positive framing to, think through things and not get bogged down by, with challenges or criticisms or doubt. Now, the assembly has almost lasted a week, and it's been quite intensive discussions around various topics. What have been the key moments for you during this World Health Assembly? Could you just summarize for our audiences?
Are you sure it's only been a week? It feels longer than a week. And I would start, though, by paying 2 tributes. One is to the WHO staff. Mm-hmm. The energy and the patience, the diplomacy, the scientific, I think it does make you proud to be part of WHO, I have to say. And I would also pay tribute, because I think they have an extraordinarily difficult job, to the diplomats.
Yes.
Here. Mm-hmm. They are jockeying between their capitals, the debates here, the other countries, and think what the world would be like if there was no forum by which these really difficult debates couldn't happen. Mm-hmm. And there are some very difficult debates. We know the conflicts around the world and terrible things happening, the fear of future pandemics. But the highlights for me are, number one, the fact that we have a forum where even countries that are in conflict can be heard and listened to, and debates can happen. Mm-hmm. The world would be poor if that were not true. Mm-hmm. The WHA, the World Health Assembly this week, passed resolutions on climate change. Yeah. That's a huge step forward. Huge step forward. We launched for the beginning of 2025 the General Programme of Work, which is WHO's strategy. That has 2 elements that are dedicated to climate change. Mm-hmm. It made the case for gender and for equity and for science. Mm-hmm. And there were resolutions on a number of other issues, from non-communicable disease. Together, you get in the midst of it on Tuesday, Wednesday, Thursday, and you think we're making no progress. Yeah. And maybe later on today or tomorrow, we will have agreement on the international health regulations. Mm-hmm. And we'll have a pathway maybe for the INB discussions around the pandemic accord. Mm-hmm. That's not bad for a week's work.
Mm-hmm. Yes, there's been a lot of highlights and progress, but I specifically wanted to hear from you which one stood out. So it's great progress on the health crisis. The climate crisis is a health crisis being recognized, and there's a language around it through the resolution being passed and various resolutions, the investment case, AMR, digital. It's been a fantastic week.
Sometimes you get overwhelmed by the shadows.
Yeah.
And you don't realize the sun comes up.
Yeah, exactly. And you have to look up and see the beauty around you and the progress around you. So I'll ask you with the last question for our audiences, your chief scientist. For the young people, for the youth, to inspire scientific rigor and love for science. What would be your parting thoughts on this? What did you do to develop that love for science, that curious bent of mind, and constantly looking for the new thing, not being bogged down by challenges?
Because I think science allows you to see the world today, but it also allows you a window on the world of tomorrow, which is beyond. My mother was an artist, and we used to argue a lot about whether art or science was more creative. The truth is they're both creative, but it's similar. You start as an artist with a blank canvas, you don't know what you're going to paint. You start with science with knowing where the boundaries are, but the excitement is what's over that horizon, and that's what science can give. So I'm not going to give advice to anybody younger than me. I've got 3 children, and they would tell you it's not wise. Engage, do the very best, push the boundaries, and then a little bit further. Ask for forgiveness, not for permission. Have a smile and have a laugh, because it's got to be enjoyable. And be active, and I also say politically active, because the future is not in my hands, maybe in yours. Be politically active as well, because if we don't take science out of its ivory towers and into our communities, scientists can be activists as well.
That's very thought-provoking. Well, not an advice, but a call to action to our young audiences to be engaged and to keep that curiosity alive and also stand for the right things in life. Thank you so much, Jeremy. It was a lovely conversation with you, and we'll have more social media lives, not during the World Health Assembly, which is closing down, but I hope you can join on future conversations. Thank you so much for joining in, and with that, goodbye.